is Angie Geren. I am founder and executive director of Addiction Haven. I am also a person in long-term recovery, and what that means to me is that I have been working on self-actualization and coping skills and becoming a better mother, sister, daughter, and business owner for the past about 15 years. I'm also the mother of a daughter who has struggled with addiction and is currently in recovery herself, and a sibling of loss. My loved one passed away in September of 2013. Now, at that time, it was like on the support groups, it was every couple months we would have somebody in the support groups losing one of their kids, kind of thing. But that was still in 2013, 3 years before they actually declared it. By the time they declared it an epidemic, you couldn't go on there without seeing, numerous posts. And current statistics in Arizona are 4 Arizonans every day die of an opioid overdose. So Governor Ducey in June of 2017 declared a public health emergency for opioids. And in that declaration, he had asked for everybody to report opioid overdoses and then overdose deaths. And that was different. We'd never had real-time data. We were actually we were the first state to have real-time opioid death and overdose data. Previously, they had thought that there was only 2 Arizonans dying every day. Of course, with the statistics that were coming out, we were looking at about 4, which is about 10% of all overdoses that occur. So if you're looking at 4 people are dying every day, that's only 10%, so about 40 overdoses. Some days are worse than others, right? I mean, that's an average is what you're looking at. For the past 2 months, though, with the spike in fentanyl being in everything, our current numbers for those last 2 months were 13 people a day, because fentanyl is so potent. But part of the reason fentanyl is on the market is because our policy that we have enacted, while enacted with really good intentions, has unintended consequences when you don't understand the nature of addiction. When we think we can take a substance away because the substance is the problem, all that does is leave an open space for new substances to take its place. So the unintended consequence of all of our prescribing guidelines and having less opioid prescriptions out there made it so you can't buy prescription pills on the market, on the black market as much on the street, because they're just not available. And if they are available, they're really expensive. And so you kind of price out the average user, right? That's how heroin was able to come in and take its place so easily. Once a pill that you used to buy for $5 to $10 is now $30 to $40, you can no longer sustain that, right? And so you're going to switch to the next most powerful thing that you can spend less money to help you use it longer, right? When we start cracking down on that way, then we just have more powerful things that enter the market, because we have a demand for them. We're demanding them. And so, it's all the law of economics, right? Like demand and supply. So if there's a demand for it, there's going to be a supply. Now, if we can't supply these one things, we can come in and supply other things. So the majority, if not all, of the pills on the street at this point, whether they be opioids, whether they be benzodiazepines like Xanax or Valium, they almost all have fentanyl in them, because fentanyl's cheap and you can make it at home, and it goes a long way. And so we'll see that, be there, and then even stronger things if we continue to look at it in a punitive way, once we start taking a public health focused, policy towards addiction and looking at it as what it is, which is, a health issue, we'll be able to start getting behind the eight ball, you know what I mean? In front of the eight ball, I should say. We're always behind the eight ball right now. We're talking about the opioid epidemic in 2016 to 2019 when our teenagers are no longer using them. Our teenagers have been using cocaine and they've been using stimulants for years because our messaging has gotten out. What we want them to do, right? Don't use opioids. Opioids are addictive. You can use them for a few days and you can develop an addiction. They're like, okay, well, I'm going to stay away from them. But we never addressed the fact that they were using them for a reason. That they were anxious, that they were depressed, that they have a lot of stress on them that we never did growing up, and that they served a purpose. And until we address the fact that drugs and alcohol serve a purpose for the people who are using them, we'll always just be chasing the next epidemic.